My name is Paige Moore. I'm a school psychologist at Child Development with Prisma Health. So I'm originally from Orlando, Florida. I attended the University of Virginia for my bachelor's degree in psychology. Then I moved on to Virginia Commonwealth University, and I have a master's of science in criminal justice. And then finally I ended up here in South Carolina, and I have a PhD in school psychology from the University of South Carolina. What we do at Child Development is assess children that are referred to us from their primary care provider. We're looking at a range of neurodevelopmental disorders, including things like developmental delay, autism, intellectual disability, learning disability, and ADHD. So our goal is to answer the referral question by evaluation, but we also want to help the parents better understand their child and their child's strengths and weaknesses and what we might recommend as next steps to help the child. What steered me into this particular profession was that I was a substitute teacher when I was working on my master's degree, and during that time I was part of 2 different research studies that looked at juvenile delinquents and adult offenders, and oftentimes we found that these individuals had difficulties with learning. They felt like they weren't getting the appropriate help in school. We had high rates of dropout. So I really wanted to help children like this because every child deserves the opportunity to maximize their potential regardless of what that is. And so that's what really drove me into the field of school psychology. I educate and inspire health with the children and families I work with by just letting them know that it's okay to be different. We all are different in some ways. I let them ask me questions. We have back and forth dialogue. We sit down one-on-one and go through everything. And it's a real opportunity for the child to understand why they might be a little bit different or why they might be struggling with learning. But it's also an opportunity for families to better understand their child, which helps with parenting overall. Children don't exist in a vacuum, so the families are part of this evaluation process as well. Outside of healthcare, my interests really are focused on my family. I enjoy spending time with my husband and my 2 children. My children are of the age now that they're involved in many school and sports activities, and I'm just so thankful that I can be present and active in their lives, and I enjoy watching all of their accomplishments and watching them grow. So it's really family and friends is what I spend my time on outside of my job. To make an appointment at our clinic, please ask your primary care provider to make a referral.